Awesome. So that took a little longer than expected. Intros always do. So I'm going to try to move quickly. Can you see my screen? Can you see the right screen, not like presenter view? Okay, cool. So this is what we did. We already did welcome and introductions. I'm going to walk through very briefly benefits and expectations, our technical assistance approach, planned activities, some definitions, and like some really quick orientation. And then we're going to get you into breakout rooms to get started. So this is what we just went through. So we're not going to do that again. In terms of benefits and expectations, I'm excited that all of you are at the table as champions for change. And I'm hoping I've done team-based work like this in various kinds of ways in the past. And I find that having peers troubleshoot and share their perspectives is a smart way to try to find collective solutions. We are hoping that you can participate in all program components. We're going to be recording this, as I mentioned. We'll record each of the first half of each meeting, not the discussion in the breakout groups, but the part with my face or another person that's presenting information, so that if you do have to miss, or if a team member has to miss, that you can go back and listen. But we are hoping that you will be able to be present for as many sessions as possible. Our metric in terms of the CDC is hoping that none of you will miss more than one session. So to the extent that you can help us meet that, that would be great. Please stay engaged and present to the best of your ability. I know you have lots of competing demands. Share your insights, opinions, advice, ideas, and opportunities respectfully but candidly. I strongly believe we can't solve things that we can't articulate, or if we're not honest and able to diagnose what's happening, then we can't really change it. Develop and implement an action plan to improve diversity, equity, inclusion, and justice at your institution and improve patient care. So that is what lies ahead in terms of benefits and expectations. Our approach is we'll have five synchronous sessions that we facilitate, and those dates are going to be coming up on the next slide, I believe, or in a future slide. And then team initiated internal meetings based on what you all deem you need to do as a group at your institution. We're going to be meeting over 3 months, approximately every other week. There's like a 3-week gap, I think, between this one and the next one, but it's generally every other week. And then after our 5 sessions together, there will be monthly optional touch points where you can dial in if you'd like to talk about any challenges or progress, or talk with peers about something that you're stuck on. If I'm able to recruit some subject matter experts, we may feature some people talking about particular topics, so stay tuned for that. But those will be optional, and then a required 6 and 12 month checkpoint. So I'm going to guide you through an organizational assessment. Like I said, we have 5 required meetings. We'll have an action plan template that you work on, and then collectively your group will help implement. At some point, I'll do an interview with each of the teams. We'll follow up at 6 and 12 months to look at progress, and I'll provide optional readings, learning modules, and checkpoints to help support you, and knowing that you're all very busy and all of you may be coming at this at a different level. Those things will be based on your interest, time, and ability to complete those. Part of the foundation of our DEIJ work together is this DC Hospital Association Health Equity Framework that they came up with and published last June. This is something I sent out in the email reminder to you all, but I will send it again, or Ruta will send it again. One of us will after this meeting. And it's just a PDF with a commitment to accountability, mitigating bias, diversifying leadership, developing workforce pipelines, purchase and investing locally, and addressing social needs in order to move the needle on equity. And our primary focus areas for our work are going to be mitigating bias and addressing social needs in our project. So we'll get at those things with the organizational assessment. You'll notice that the questions in the organizational assessment that you'll complete are primarily based on this document and the cultural and linguistically appropriate standards, the class standards. So those two frameworks, the class standards, which are standards, not a framework, and this conceptual framework are really the basis of all of the questions you're going to be asked to think about at your own institution in order to identify priorities for change. There is a 5-hour training that I helped develop with a lot of input from people who are no longer on my team, actually, but we did 36 interviews with cancer survivors. We did an environmental scan. We did a survey of 400 oncology clinicians, and we had peer review of each of these modules, including Dr. Lori Wilson, who we lost recently, reviewed every one of these modules, and these are optional for you to review, but Ruta, could you put how to access this in the chat? It's also in the Google document that I shared with you. And if you have trouble with accessing the Google Doc, I also saved it as a Word doc and will reattach that in the email that follows this recording. But the topics that are covered in that optional 5-hour CE accredited team training, team stands for together, equitable, accessible, meaningful, are determinants of inequity, intersectionality. There's a spotlight on LGBT issues, African American and Black patients, Latino patients. There's a session on implicit bias, strategies for healthcare professionals to promote equity, and institutional strategies. Also patient engagement in research and clinical care, aids in communication, and patient self-advocacy. So if you're interested in learning more and digging deeper there are CME, CNE credits available, and it's totally free. And that is available on our learning management system. So this is what our time together is going to look like. Hopefully you have all been able to do the implicit attitudes test, which I'm going to talk about a little bit in a minute. Today is our kickoff and orientation. On the 26th, we'll be talking about culturally appropriate care. On May 10th, we're going to talk about healthy, equitable communities and community engagement. On May 24th, we're going to talk about communicating equity to stakeholders and inclusive governance. June 7th, we will be focused on your action planning for healthy and equitable communities. The first Wednesday of the month at 8 o'clock, for the following 12-month period, I will be available with other people for optional checkpoints for 10 of those sessions. And then for December 6th and June 5th, those would be required checkpoints so that we can look at progress and see how you're doing. And then we'll ask you to do the IAT, the implicit attitudes test, at the end. So this past week and then 15 months from now, just for us to see if there's any change collectively in the group. So when you're doing the organizational assessment, I'm giving you a couple of options. I've given you a Google Doc and Word version of the assessment questions. The assessment questions are also listed on the agenda that I shared with you so that you can think about them ahead of time. But ultimately, you're going to be entering them into our REDCap system, and I will send you the link to put your data in there. You will be able to save your progress, revise what you've written, and send yourself the link within REDCap so that you can make progress over the course of the sessions. I realize that everyone has different levels of kind of ways of organizing themselves and different ways of gathering their thoughts. So feel free to use the Google document or the Word doc to draft thoughts and then put it into REDCap. Feel free to put it into REDCap directly as a team. We'll get to that during the breakout groups. But you'll want one person on each team. When you go to breakouts today, identify one person that you want to actually put the information into REDCap for your team. So that's going to be your data entry person. Just nominate or self-nominate or nominate someone in your group to be the person entering the information your team collectively decides for answers for each of the organizational assessment questions. And then you'll also have an action plan update at 6 months and 12 months in REDCap. This is what your action plan template looks like. So you will have an overarching goal of what you want to accomplish. And there's a typo there because I adapted this from a prior intervention. So sorry about that in terms of the goal. But your goals are going to also be specific, measurable, achievable, relevant. And we've added, since this screenshot, we've added inclusive and equitable. So it's SMARTY instead of SMART goals. You'll identify a person responsible for that particular activity, resources that you need to accomplish your activity, a date for completion, and how you'll measure progress. So this is kind of your template for once you go through your organizational assessment, you will identify, okay, this is what things look like. What do we want to focus on? So after at the end of 4 of our sessions, you will have a lot of information about what's happening at your institution. You'll then look at that information and say, what do we want to do about it? And identify 3 to 5 goals or 3 to 5 objectives that you want to accomplish over 12 months. And then you'll fill out this template. Your progress report looks very similar. You will just repeat the objectives that you have decided on, and then report on any progress, barriers, next steps, and the degree to which you were able to complete the activity at 6 months and at 12 months. And this is one of our key metrics for our Centers for Disease Control project. As I mentioned, it's a multi-level project. This is the system level part of the project. The provider level was the implicit bias training, and the patient level is the direct screening for social needs and community health worker intervention that each of our institutions are participating in. Okay, so kind of briefly, I want to just kind of level set in terms of some of the terminology. And this is where you get to come off mute and share your own perspective. I'd love to stop hearing myself speak at this point. So implicit bias, diversity, equity, inclusion, and justice. When you hear implicit bias, what does that mean to you? Anyone can come off mute. And I know you're all super smart, so you're just being quiet because you're shy or you're multitasking. So who's a brave volunteer to define implicit bias?
I can. This is Tunisia. So for me, it means like when things occur unintentionally and automatically, like I can't really explain it.
No, that's great. That's perfect. It's like,
yeah, like when it's just it's just something that just happens, but not necessarily, and it kind of affects like the judgment and the perspective people have.
exactly. It's unconscious. It's something that happens without our consciousness. So that's absolutely perfect. Can I have another brave volunteer define diversity?
It's Linda. Hey. So for me, diversity is about the many ways that we are different, and that with our differences could be cultural, could be genetic, could be where we were brought up, could be race. There's diversity is that we're different, but yeah, I think that's it. I'll leave it there. It becomes a ramble after that.
No worries. Thank you so much. And may I have another wonderful team member define equity?
I can do equity. This is TTI. As sort of just recognizing that everyone is different, has inherent different circumstances, but then trying to figure out what to do or how to make it so that everyone has the same potential for the same outcome. So that might be more to one person, less to another, just to try and equal things out.
Perfect. Wonderful. You guys are already, you guys are in it. Someone else for inclusion.
Hello, how about being a part of a group or including an individual, no matter what their race, their special needs are, But being included into, I would say the population, included in a group, included in school, included at work. It's just, you're not, anyone is not to exclude them.
Great. And justice.
Hi, this is Dawn. For me, justice means treatment, including someone, rights, sort of that nature.
Okay. Thank you guys so much. I really appreciate the engagement. So so these are, these are just not perfect definitions. They're just a general definition of kind of level setting where we're at, which is really what you guys just said. So negative attitudes we're not conscious of having would be related to implicit bias, having a full spectrum of lived experiences, accounting for advantages and opportunity is at least one definition of diversity. Equity, allocating resources based on need, inclusion, belonging, and justice, dismantling barriers and creating opportunities so that all people can live full and dignified lives. So this is what our focus is in this work. So I think that you all are probably on the same train with me and have a pretty good understanding of this stuff. But, when we're thinking about cancer health disparities, a lot of times the literature and the way that we've talked about things historically, we've talked about, well, race predicts this or gender predicts this. And really, what we're talking about is individual characteristics don't really cause disparities. It's really the social processes and social structural consequences of those processes and the way that things have been embedded into our culture that result in worse outcomes for some people, right? So it's really the transphobia, heterosexism, ableism, racism, classism, sexism, that lead to those health inequities and the poverty and the social conditions that result in worse health outcomes. So just wanted to kind of, again, level set there. And really all of those are based on our capitalist, colonial, and, kind of way in which our country was founded and the fact that our economy was really founded on slavery. I mean, a lot of these things are coming out of an economic system, a financial system, and structures, an educational system, a healthcare system that was built with particular assumptions, with particular people at the table, and that intentionally excluded a large part of the population, right? So I know that that's a lot. I don't think it's probably controversial in this group, but I wanted to just state that. And put it out there that really, kind of the differences we see were differences that were intended. And so unraveling those takes effort, and inertia doesn't get us there, right? Because if we do more of the same, we're going to get more of the same. So when we think about intersectionality, hopefully this is a term that you have kind of heard before, but it's just really getting at kind of the different ways in which we experience power, and the fact that we all experience vulnerability at times, we all experience power at times, doesn't mean that we all have the same amount of influence in a particular setting or the same vulnerability in a particular context, but we have a lot of different aspects of our identities that lead to how we experience the world. And so just some things for you to reflect on and think about what ways that you have power, in what situations you feel you have power, in what ways you feel vulnerable to others, and how does your positionality affect your health? And I find that, this is kind of just a useful exercise in terms of thinking about our own positionality, and then the positionality of people we work with, and the positionality of the patients that come into our care and our systems, and ways that they might experience power, and the symbols around them, the context that our clinical context, our environmental context, the ways in which we interact with people, and how that might affect how people feel in terms of vulnerability or power. A couple of other orientation points. As I was preparing for this today, I found that there are new standards from the Joint Commission that I discovered. We will also send those out in the email that follows this. Someone also asked if I would share the slides, and yes, we will share a PDF of the slides. We will share a PDF of the Joint Commission new standards, a PDF of the conceptual framework of the DC Health Association that I briefly mentioned, and the Word document of the kind of what to expect agenda and assessment questions. So the Joint Commission now requires that organizations designate, this is as of 2022, or actually 2023, I think it's super new, that the organization designate an individual or individuals to lead activities to reduce healthcare disparities for patients, that the organization assesses the patient's health-related social needs and provides information about community resources and support services. So that is something that we're doing in the other part of our project. We're doing social needs screening and linking patients to community resources and then community health worker support based on need and eligibility. The Joint Commission now requires that organizations identify healthcare disparities in the patient population by stratifying quality and safety data by sociodemographics. And there is a requirement to capture race and ethnicity in the organization's demographics. The organization develop a written action plan to describe how it will address disparities. So this project will directly align with this requirement. You will have a written action plan, and you will hopefully be able to use that to align with this particular requirement from the Joint Commission. The organization acts when it does not achieve or sustain the goals in its action plan. So revising kind of this plan, do, study, do, act cycle, where if something's not working, you pivot and find a way to advance the goals that you're trying to advance. At least annually inform key stakeholders, including leaders, practitioners, staff, about progress identified. Progress to reduce the identified healthcare disparities, and that the medical record contains information that reflects the patient's care. And I think I inadvertently left off the requirement for race and ethnicity here. So I know that we're moving really quickly, but that's intentional because I know you all are so busy, and we needed to choose between going slowly and having more of your time, or trying to be as efficient as possible. So I'm going to walk through a couple of things that I think may have come up during the IAT, and then take any questions, and then we will give you a few minutes to take a look at the organizational assessment in breakout groups. So for any of you how many of you, maybe raise your hand if the implicit attitudes test was something new for you, that you had never heard of it or hadn't taken it before? Okay, so the implicit attitudes test, it measures the strength of associations between concepts, right? So it's how our instincts kind of link together certain ideas, right? It's not intended to be a judgment. We all have implicit bias, all of us. We have implicit bias based on how we're taught, how we're socialized, what we're exposed to. And so it's not intended to be a judgment of any kind. It's really just an orientation to give you some information about what you associate, right? If it says that you have a particular preference for a group, does that mean that you're prejudiced? That means that you have a certain orientation that kind of automatically associates certain things like good or like bad with a certain group. And it's something that can change. It's something that can change over time. So again, we're all socialized. We think the thoughts that we're taught to think. We think the thoughts that we're educated to think. We think the thoughts that people around us have told us. And there are ways to pivot. There are ways to adjust this. So if you didn't like your result, that's okay. You can challenge those associations and biases by exposing yourself, by some of the optional readings that I'll provide, some of the optional learning modules. These are ways that you can start to create a broader view than maybe if there was a result that you didn't like. If you liked your result, that's fine too. But I just figured there would probably be some questions about the purpose of the IET, what it's trying to measure, and what your results mean. And again, I'm going to send these slides out. These are literally screenshots from, if you Google what does the IIT mean or project implicit at Harvard, this frequently asked question document will come up and the things that are on the screen will show up. So you can go through that more slowly if you would like to. You can review the slides after this session. We will send them out. But again, exposing yourself to other things that you haven't been exposed to. Watching movies that have different characters, watching shows that have different characters, expanding your friend network, reading books. These are all things that we can do to kind of intentionally broaden our lens and kind of expand what we have exposed to us in terms of how to influence our own biases. So I'm going to stop there before we jump into the breakouts and see if there are any questions at this point, knowing you're going to get these slides, you're going to get the conceptual framework and the questions. After this, we'll get the recording of the session, a link to the recording of the session. Do you have any questions at this point before we go into the breakout rooms and give you a little bit of time to start working on your assessment questions? This is the link. Ruta, could you put this link into the chat for folks? And you can click on the link, but don't start filling things out yet, because when you get to your breakout groups, you'll want to choose one person from your group, not all of you, one person to actually click on the link and complete the questions in REDCap. So we don't want all of you to do it. We just want one person in your group to do it. So this week, what you're going to do is you're going to have a little bit of time, not a lot, for breakouts right now. And then probably what you're going to do is find out, I don't know the answer to this question, and figure out, how do I find the answer to this question? And then that will be your homework this week. Also optional is the team training I mentioned. If you want to take that or start taking that, that is up to you. If you want to share that with others, that is up to you. It's not required, but it's there for your support. And these are the questions that you're going to be starting